February is American Heart Month, meant to spread awareness about heart disease. It's the leading cause of death in the U.S., and here to tell us more is Dr. Marina Jansen, cardiologist at Virginia Mason Franciscan Health. Thank you so much for being here.
Thank you. Thank you for having me.
And you're wearing your red for Heart Month, which is very important.
Thank you.
I want to start the conversation about blood pressure, if we can, and why that is so important.
Blood pressure is one of the very important parameters of your health, and a lot of times more than almost half of Americans have elevated blood pressure, have hypertension, and don't know about it. A lot of people don't know about it, but it's a risk factor for a lot of cardiovascular disease, like heart attack and stroke, and a lot of other issues.
So if people have high blood pressure, should they be coming in and seeing someone then? Is it an immediate?
Absolutely, that's very important, because the longer you have untreated high blood pressures, the longer you let them stay with you, the higher the risk and higher the amount of damage that's done to your vessel, heart, and brain.
Oh my gosh. And I understand it's called sometimes the silent condition. How can it be so serious and a common issue, but something that so many people don't find out about?
Well, if you think about it, what is high blood pressure? It's a elevation of pressure inside of the vessels of our body, right? So if you imagine a hose and you turn it all the way, like the water hose, turn it all the way open, and all that pressure within the walls of that hose that's generated is representing the elevated blood pressure in our vessels. But it's just the pipe, right? So you're not going to have any symptoms early in the disease. So there may be years gone by without you knowing that you actually have elevated blood pressures while the damage is being done.
Oh my gosh, so it's important to check, and you brought some stuff with you, so please explain how it can be measured there.
So we have different types of blood pressure cuffs nowadays. We have the wrist cuffs, and then we also have the arm cuffs that the arm cuffs tend to be more accurate. The wrist cuffs are usually applied on the wrist, and you've got to uncross your legs every time you're measuring your blood pressure.
I feel like every time, they told me that. Okay.
So the wrist cuffs are put this way, and then you just push the button and it gives you the readings. So those are relatively simple, but they tend to have a little more measurement error. The blood pressure cuffs that go on your arm, you've got to make sure that you choose the right size, because there are smaller ones for smaller individuals and bigger ones, like extra large sizes. And you've got to measure it on the bare arm. So you want to do it on the bare arm and follow the markers that says artery. And our artery is usually in the middle, right here. So we put it this way, and then we use our manometer to generate the pressure, and you have to use the stethoscope applied right to the artery, because you need to listen and see when you start hearing the sounds of the cortical sounds for the blood pressure measurement.
Okay, so when I'm at home or people are at home checking their own blood pressure, what number should we be looking for? What should we be checking?
So normal blood pressure numbers are less than 120/80. I know everybody used to thinking like, up to 140 is just fine. No, 140 and above is a stage 2 hypertension already. And a lot of people think that 130 is normal, or even 127 is already elevated blood pressure.
And what are 3 things that people could be doing at home to help with high blood pressure?
The easiest things to do, the easiest, I guess, when you say it's easiest, but at the same time, they are maybe the hardest, but limiting salt in your diet can help reduce your blood pressure. Salt raises blood pressure significantly, but it's hard to limit it because you go out to a restaurant, you go out somewhere else to eat, and all that food is delicious because it has plenty of butter and salt.
Right.
The other thing that you could do, you said 3 things, right? The
Yep.
second thing you could do would be maintaining healthy weight by exercising on a regular basis. And the third thing that you could do is limiting your alcohol and tobacco. Those 2 things are also known to elevate your blood pressures.
Amazing. Thank you so much for your time. This was great. And for more information, head to the website that you see right there on your screen, vmfh.org/heart. New Day Northwest is sponsored by Virginia Mason Franciscan Health.